Welcome to the Every Mom is an Athlete podcast, where we believe that motherhood is inherently athletic. I see you lifting car seats, chasing toddlers, and carrying groceries one-handed while holding a baby and a coffee. Your daily life is a workout. I'm Dr. Karlie, pregnancy and postpartum expert, sports chiropractor, strength coach, entrepreneur, and mom of three. Here you'll find solo episodes and real conversations with other moms and leading experts, so you can live your strongest, healthiest, most aligned life in motherhood. No matter how long it's been since you've had your baby, whether you're reconnecting with your body, rebuilding your strength, or just figuring out what feels good again, you're in the right place. Hello, strong moms, and welcome back to Every Mom is an Athlete. Today, we're talking about hip pain, which is one of the most common complaints I see in my office, and not just from high-level athletes, but moms, weekend warriors, people who work at their desk, all kinds of people. So let's talk about hip pain. And by the end of this episode, I promise you're going to understand why hip pain happens and what you can do to start fixing it. Hip pain is actually sort of a catch-all term, right? It's not a diagnosis. So sometimes when people come in, they say that their hip hurts, and we're talking like maybe right in their hip flexor, right in the front of the hip. Maybe they're talking about in the groin. Maybe they're talking about sort of on the lateral hip, or like even that like outer butt region. And some people even come in and talk about their low back hurting and they call it their hip. So when we're talking about hip pain, I'm just going to sort of throw that all into this category and talk about different ways that your hip can hurt and different reasons why and what we can do about that pain. So there are some really common causes that I see in my office that people end up with pain in their hip. One is from the way that we live our lives, right? As a society, especially as new moms, we're sitting a lot if you're nursing. But if you're a little farther along, right, maybe you're back at a desk, maybe you're driving a lot, that sitting for so long is just not a natural way that we're meant to move our bodies, okay? We're meant to be like out like gathering berries and hunting lions and whatever, right? We're like supposed to be way more active than we are in our current state. So that sitting can be really detrimental. I'm sure you've heard it said that sitting is the new smoking. And like, I truly subscribe to that because I think it is just like one of the things that is really like detrimental to our health and can snowball into other unhealthy habits. So when we talk about sitting too much, what is happening, right? So what happens there is we end up lots of times not sitting in a good posture, right? So we don't sit straight up on our sits bones. We end up sort of slouching. And what that does is it lets our hip flexors tighten on the front side. Those hip flexors, so our psoas in particular, it actually attaches not only into your hip, but it attaches to the front of your low back, to the actual spine. So you can imagine if that is all tightening on the front, it's going to flatten out your spine. It's going to flatten out your low back. That just puts you in a position that is less ideal, right? And so your glutes are getting sort of stretched and weakened. Your hip flexors on the front are tight. That's pulling on your spine. And then if you're slouching a little bit, kind of like leaning your low back into the chair instead of sitting up tall with like a lumbar support or something, that's just going to sort of snowball again this whole process of like tight hip flexors, weak glutes, blah, 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 blah. And so that's where I see a lot of this pain in the hip or the low back originating from, right? Is just by sitting too much. The other things that I see are we have to look at the rest of the body, right? Like I said, I already talked about the low back a little bit. We have to look at what's going on with all the way down to the ankles, the knees, the upper back, how our breathing is. All of these things, I know it can sometimes feel overwhelming, but they're actually all connected, right? And so we have to look sort of at the whole body to get a good picture of what's happening and why we're getting pain in one area. So we can look at repetitive strain. So let's take running, for example. If you're running, let's say you're getting back into running and you're training for a 5K or 10K or whatever it is, even if you're walk running, that's a lot of reps to be putting on your body. And let's imagine that one of your ankles is not quite moving as much as it should. It's sort of locked up, right? It happens for all kinds of reasons. Maybe you rolled it, you didn't even remember, kind of shifted the joint a little bit. Maybe you don't even notice, but it slightly could change the way that you're running. And so that's going to change the way the knee is moving, potentially how the hips are moving, and then you get some compensation up the chain. This is why it's really important to look at the whole body, to not just go into someone and like say, here my hip hurts and like get an injection or something, right? Because potentially you're missing like where the problem is coming from and you're just looking at the symptom, right? So this is why I'm always encouraging people with issues like this, to go in, get some advice from a chiropractor, physical therapist, even a physiatrist, which is a medical doctor who is like an orthopedist, but they just don't do surgery, right? So they do a lot of other stuff. So this is why I'm always trying to get people to go see someone when you have these issues. Now, if you can't get in to see someone, there are lots of other things you can do. We're going to talk about some of that stuff today. I also do have a plan that I created for people in that specific instance. So if you're having hip pain, back pain, sciatica, all these things, check out my Fix Your Pelvic Pain plan because it's like $74 and it walks you through not only how to mobilize your pelvis, but then how to stabilize it, specific exercises, reps and sets, all that stuff that you should do for each specific injury. So there's that for you if you need. Now, let's talk about pregnancy real quick or that early postpartum phase. Also, hormonal changes, muscle weakness, the change in your pelvis alignment during pregnancy, all those can also contribute to hip pain. Additional weight, right, on your pelvis and even the way that you're sleeping. I hear from a lot of pregnant women towards the end of pregnancy that their hips are so sore laying on their sides at night. And then sometimes that transfers right into postpartum, right? And like even beyond that newly postpartum phase, remember, postpartum is forever. So like even years later, that can still be an issue if we haven't addressed it. So the main thing I want you to hear here is that hip pain isn't usually just from one thing. It can be a combo of a lot of different things, imbalance and overuse. And our bodies are smart, right? So we're just going to keep kind of compensating to do the things we want to do, to be running, to chase our kids around, to be able to sit at our desk, whatever we got to do, we're going to compensate to make those things happen. And so then we sort of have to like unravel those compensation patterns to figure out how we can fix this in the first place. And I want to touch on one other thing, actually. I think I'll do a whole podcast episode about this in the future, but there also is some really cool info out there on how our mental and emotional pains or trauma or past things that have happened can manifest themselves physically. So we're not going to get into that today, but that is just something that is really interesting if you have ever gotten worked on physically, like in a massage or something, and just felt like a release, like you've started crying or you've just felt really emotional. There's some really cool stuff out there about how our body holds that trauma in. So that's another thing just to consider. Again, we'll chat about that and like geek out about that on another podcast, but just something I want you to keep in mind. So let's start to talk about what we can do if we're having pain, short of like getting in to see someone, checking out my plan. What can you start on your own at home? I always recommend my patients start at home, like see what you can do first, grab your foam roller, look up some breathing drills, see what you can find to help you. And sometimes that's enough and that's great. Maybe you can solve it on your own. Sometimes we need a little more help, but let's just talk about some things that you could start doing at home. Now, if you've listened to anything I talk about, you know I am like a big breathing geek. I really, truly want people to understand the connection between our breath and how our body functions. And so the real quick way of describing that is if you are thinking about your core, your diaphragm, so that's like right under your ribs, okay, that's your main breathing muscle. Your pelvic floor, right? We all are pelvic floor. We know where that is, right? So those are the top and the bottom of our quote unquote core. Then we have our muscles around, our low back muscles, our abs, our glutes connect in there, all these other muscles. But that's the top and bottom of this sort of barrel. If you're not breathing properly, it causes a whole host of problems, which we can see in all different parts of the body, okay? So we could end up with low back pain, we could end up with neck pain, we can end up with shoulder pain. Like really, truly, we could bring a lot of stuff back to breathing. Like I'm not going to say everything is, due to poor breathing mechanics, but for a lot of us, it is. We're stressed, right? And when we're stressed, we don't use that primary muscle. We end up using our little accessory muscles, which are the ones up in our neck, okay? And so that's when people come into my office and their neck is just so tight. All their neck muscles are so tight. When I look at their breathing patterns, very often I see that they are not breathing deeply. Sometimes they're even breathing backward. We call it paradoxical, basically, where when you take a breath, when you take a breath in, your belly is supposed to expand out. And when you breathe out, your belly sort of pulls in. So it's sort of opposite what most people think. You can think about that for a minute. Just take one big breath in your belly should be expanded out. And as you breathe out, now your belly pulls in a little bit. Your lungs are expressing that air out. Your diaphragm is moving up. Anyways, give that a try. If you're doing that backwards, that's one thing you already know you can work on, right? But so I see some of these patterns when people come in. And so we have to look at breathing mechanics pretty much in like any injury, okay? It's always like a little tiny piece of the puzzle. Then we also want to look at pelvic alignment, right? Remember, you've got your hip, right? It's a ball and socket joint, but it comes up and it attaches right into your pelvis. So you can't really look at the hip without looking at the pelvis and vice versa. So there, what we've got to look at is, okay, how is your pelvis moving? Like, are both of those big bones? So if you think about, you have those kind of little dimples in the back of your back, that's part of the big pelvic bone on each side. And so those can move individually. So one could rotate forward a little bit, one could rotate back a little bit. And then you can imagine that's going to put different strain on the muscles that are attaching in there. So we really want to look at the alignment, and then we want to look how the muscles are functioning. Imagine again, one is rotated forward a little bit, one's rotated back. And now you're asking the muscles to stabilize, but like one is lengthened and one is shortened, and they're not going to be able to do exactly what they're supposed to do. And so those often go together. You'll hear people say, oh, I went to the PT or the chiropractor and they said that I have a weak glute or my glute's not firing. Well, is your glute really not firing? Is it really truly weak? Often it's not. Often what's happening is your pelvis isn't in a good position. And so your body isn't allowing it to fire and to engage the way that it's supposed to. But if we could get things aligned better and do a little bit of training in this better position, you would have better results. And the glute would actually, quote unquote, start firing when like it was firing before. It just wasn't firing optimally, right? So sometimes, truly the muscle is just like not working and has been inhibited. And that does happen, right? But lots of times we have to look at the pelvic alignment first. And then we can see like, okay, what's going on with the muscles? Again, that pelvic alignment piece, I know it can feel frustrating. Like, okay, well, if my pelvis is not aligned, what do I do? Again, options are get in to see a chiropractor, a physical therapist. I prefer a pelvic floor physical therapist for this, although obviously there's like a ton of other regular physical therapists out there that can deal with this. This is sort of all of our bread and butter, right? If you don't have that option, again, check out my Fix Your Pelvic Pain Plan because I do teach you how to realign it yourself at home, really similarly to how I do in the office. So before we talk about exercises, I want to talk little bit about stretching, muscle manipulation. What can we do to loosen the muscles? Because it really is important to have the balance of mobility and strength. We don't want to be just like a big gummy, flexy, like mobile, unstable human. And on the other end, we don't want to be just like a big, like muscle bound brute, right? We want to have a combo of both to move optimally. So let's talk about the muscle piece first. I'm a huge fan of foam rolling. The reason is you can get in and specifically loosen up trigger points. You can loosen up parts of the fascia, which can sort of restrict your range of motion. If you haven't heard of what fascia is before, lots of people have heard of plantar fascia, and that's just the fascia on the bottom of the foot. But truly, fascia goes through our whole body. Sometimes we call it like a second skeleton. It is connective tissue. So I always tell my patients, it's like, if you get a chicken like from Costco that's like already pre-cooked and there's like part of like, not the skin, but there's like that part that doesn't stretch, but it's not like the meat. Like that's sort of what fascia is like. And that goes through your whole body. It goes through your organs. It creates this second skeleton, so to speak. So what can happen is certain areas can get bound up a little bit and that can restrict your range of motion. I liken it to like, if you take your shirt and you just like twist up a little piece, you can see that that's causing a pull in other areas away from where you just twisted it, right? It's changing the pull of the material of your shirt. That's sort of what fascia is like. So you can get in there with a foam roller and you can sit on that spot, breathe into it, and like try to let it release. So that's something I have patients do a lot in my office. I find that often with hip pain, the adductors or the inner thigh muscles are really tight. So I teach them how to get in there and roll out that inner thigh muscle, and that can release a lot of the pain. I also teach them how to roll the muscle that connects to your IT band. So this is a little tiny muscle up on the lateral side of your hip, right above where like the bony part of your femur is, it's just like, I'm looking at my hands, it's like 3 or 4 inches big. Okay. So it's really small. I usually have people roll kind of back and forth. I'll link a video below of how to roll that muscle because I like just cannot explain it right here. So you can check that out. I'll link it on my YouTube, okay? That way you can see how to release that because that will often cause referral into other parts of the hip. And so that can be a big one that releases a lot of pain through the hip as well. I'm not a huge fan of stretching. I like dynamic stretching. I like opening up the hips, mobilizing, but I just think that it's really non-specific. So you can't get in and say like, I want to loosen up this spot. You're quote unquote loosening the whole muscle, but really lots of times what happens is the part that is restricted doesn't loosen and the part that's already like mobile is the one that's stretching. Does that make sense? So I really prefer foam rolling. So, okay, let's talk about exercises, okay? There are lots of hip stability drills out there. If you've ever been in to see someone, I'm sure you've gotten lateral hip work. So there's like a band around the knees, doing monster walks, doing lateral walking, glute bridges with that band around the knees, which sort of wants to pull your knees in together and you have to force them out, which engages the muscles in the hips. All those kind of things I think are great. You just really want to make sure you're using the right muscles, okay? You don't want to be compensating with a hip flexor. You want to be feeling, I call it the lateral butt. You want to be feeling the lateral butt and seeing like, is it working? Is it firing? Do I feel it strengthening? Do I feel it like hardening up under my hand? Because that is what it should feel like. Other things we want to look at are movement patterns, right? Like, what are you doing all day long that could be contributing to this? Everyone wants to talk about what we can do in the gym to fix this, but truly, like, you can do all you want in the gym, but if you're sitting with your legs crossed all day, then you're setting yourself up to have a hip issue. So look at what your day looks like. Are you sitting with good posture? Is your low back supported when you're working on your computer or in your car? Are you crossing your hips? You should not be, by the way. Are you sitting? Many women, this is not an issue, but lots of guys I see in my office, they'll be sitting on their wallet and that totally like throws your hips off, okay? So that's something we don't want to be doing. Check your husbands and your dads. Don't let them sit on their wallets. How are you sleeping at night? Are you sleeping with your legs sort of all twisted up? Are you using a pillow between the knees? That alone can be super helpful. So there's all these things through our daily life that we want to look at and see if we can fix those. Start there first, and then we can see what else we can do in the gym as far as rehab, stability, mobility, all that stuff. Also, I want to say, like, if you feel like you've done all these things, if you've been in to see chiropractor PT, you've rolled out with a foam roller, everything, nothing is working. The other thing I often have people do is go into pelvic floor PT because you have to remember the pelvic floor attaches on the inside to the pelvis the same way the muscles like the glutes and the ones that, we can see on the outside, the same way they attach. So I personally, I was having this really like deep hip pain. And I went in to see my pelvic floor physical therapist, which, by the way, she is amazing. Go back to episode 14. It's called Let's Talk About the Pelvic Floor with pelvic floor PT Rachel Kilgore. It is such a helpful episode if you've been considering pelvic floor physical therapy and like just to talk about what that looks like and all that stuff. But anyways, I went in to see her and I was like, oh my gosh, my hip is killing me. And so she's asking questions. And just like so many people, I totally forgot that I was like, oh, actually, when we were in Hawaii, I did sort of get knocked down in a wave and I felt my hip pop. And I really thought I tore my labrum. The labrum is what holds that ball and socket joint together, okay? And I tore the one on my other hip a long time ago, and we could talk about that another time too, but it felt really similar. But then it got better super quick. So I was like, okay, well, I don't think it was that. And so anyways, what we ended up finding out was that one of the internal pelvic floor muscles was strained. And when she did an internal evaluation, it was so crazy tender because those muscles, just like the outer ones, can have trigger points, can have those fascial adhesions. And so she released it. And I kid you not, my hip pain went away. So now as a chiropractor, if people come into my office and we do this whole workup, we do the evaluation, I work on their muscles, I adjust them, I give them rehab. Within a few visits, if they're not getting better, I start to think, we need to get them into pelvic floor PT because there might be something internal that's going on that neither of us are able to get to that could be the piece of the puzzle that's missing. So just something to keep in mind if you have done everything that I'm talking about and you have this persistent hip pain, we've got to look at that pelvic floor too, because it is just such a key when we're talking about how the pelvis and the hips work. All right. Well, I hope this is helpful. If you're having hip pain, you also can reach out to me. Just DM me on Instagram at Dr. Karlie. I often help people find a sports chiropractor or a pelvic floor PT in their area. And of course, if you found this episode helpful, please share it with a friend, especially your mama friend who has been complaining about her hip forever. Please share with her because we all need all the help we can get. All right, strong moms, until next time, have a great week. Talk to you soon. Thanks for listening. Every Mom is an Athlete isn't just a podcast. It's a reminder. Motherhood is athletic, and you're still the athlete you've always been. But it's not about going back. It's about moving forward intentionally and powerfully. If this episode resonated with you, I'd so appreciate it if you'd share it with a friend, leave a quick review, or rate the show. It helps more moms to hear what they need to believe, that every mom is an athlete. See you next time.